Sandra. Welcome to another episode of Norton Healthcare's Healthy Hour. This time around, we're focusing on navigating healthcare.
Whether you're figuring out financial assistance or trying to find the right provider, we've got you covered. Let's jump in. Here today, we have our Director of Customer Service and Financial Assistance, Heather Bunch.
Hello.
Hi, Heather.
Yes.
Welcome.
Thank you for having me today.
So, Heather, tell us a little bit about what you do and what your department does for Norton Healthcare.
So I oversee everything self-pay. So we offer financial assistance. So my team, they process all of the applications and we send out notices whether you're approved or not. And then I have also the customer service team. They take all of the phone calls. So every time you call about a bill, you're talking to someone from my team.
Can you talk to us a little more about the financial assistance program? Because I'm not sure if a lot of people are aware that Norton Healthcare provides this service.
Yes, absolutely. So the financial assistance program, it was created to help our patients take care of their out-of-pocket medical expenses. And it is good at all of our Norton Hospital locations, as well as our physician practices and our Norton retail pharmacy locations.
Nice. How do you even apply for the program?
Yeah, so we offer multiple ways to apply. You can do that through your My Norton Chart account. Mm-hmm. That is the easiest way. You can apply. You can also upload your documents, and you can check the status of your application. But if you prefer a different method, you can mail it in, fax it in, or email it to us.
Wow, that's very accommodating for a lot of people in different situations. That's really great.
What about individuals who may not have access to a computer or internet? Is there a place that they can go to fill out the application in person?
Yes, you can go to any of our hospital locations and you can work with a financial counselor and they will help you fill out an application. You can also call our customer service team and they'll do the application over the phone with you.
So doing a little bit of research, you guys offer the application in different languages as well, right?
Yes, we have 11 different languages that it's offered in. So you can get that on our website and you can also see all of our policies about financial assistance in those languages as well.
So if someone was to call in though, would they be able to talk to someone in their native language?
Yes, so we have interpreter services, so if you just can tell us what language you need, we can get that person on the phone with you.
What makes someone eligible for this? Is it offered to everyone, or what's the criteria?
Yeah, so anyone can apply, whether you have insurance or you're uninsured, you can still qualify. Okay. We base this off of income and resources, so we are at 350% of the federal poverty level for our income. So a family of four can make $112,525 a year, and they could still qualify.
Say that again for people. A family of four.
$112,525 a year.
Okay.
Wow.
Yeah, and you can have up to $8,200 in resources. And so if you meet those qualifications, we would love for you to apply and send that application in to us along with your bank statements.
Can you expand upon that resources part? Because I'm not really clear on what you meant by that.
Yeah, so we look at cash on hand, things like in your bank account. So if you have a checking and savings account, we would need 3 months of bank statements from your checking and your savings account.
Okay.
And is there a special type of bank account that someone should have, or just?
You don't have to have a traditional bank account.
Okay.
So we use Chime cards. So if you have a prepaid card and you don't have a traditional bank account, we can still use that. Express Pay is another big one that we receive. So you just have to call the number on the back of your card and they can send those to you, and then you can supply those to us.
And what is that number that the community can call to know more about the financial assistance program?
Yeah, you can call our customer service team at 502-479-6300. Once you're approved, it is good for 1 full year. So from the date you sign the application, you're approved, you're covered for 1 year with Norton Healthcare. And if you have prior medical balances, it's good it'll go back 2 years and take care of those medical bills as well.
Wow, and that has to be at a Norton Healthcare facility. Okay,
yes.
Perfect.
Yes.
Okay, just want to make
That's
sure.
correct.
Does it also cover any prescriptions or anything like that?
Yes, it does. As long as you use a Norton Healthcare retail pharmacy, those are covered as well.
So maybe individuals that do have insurance and have a leftover balance, how would that financial assistance program, would they still be eligible even if they do have insurance?
Absolutely, yes. So it doesn't matter if you have insurance or if you don't have insurance. If you qualify, we take care of your out-of-pocket expense completely.
Oh, no. Wow.
I heard you say it's good for 1 year. So then every year you would go through the process of applying again for you and your family.
That's correct, yes.
Okay.
Anybody can apply at any time. You do not even have to be a patient of Norton Healthcare, and you can still apply. We do pre-approvals. So when you decide you want to apply, you can go ahead and we can get that pre-approval for you.
Well, this is a great asset to the community. I'm not sure how many people know about this.
I think one question I have is, why does Norton Healthcare offer this wonderful program?
Yeah, so I think with our mission, vision, and values, we're always looking for ways to give back to the community. This program does that. It removes barriers for folks to be able to come in and have health care without the burden of the cost. And we so enjoy being able to help the community and see the benefits that this program brings about.
So Heather, thank you so much for that valuable information.
I was going just for my regular checkup with my Dr. Handel Jones, and he was examining my heart, and he said, I noticed, something sounds kind of off. No, I don't think there's anything to be concerned about, but let me do some tests.
Pastor Williams had been living with high blood pressure. Though he didn't notice it, it was doing damage to his heart.
So for Pastor and many like him, when you have high blood pressure for years, the heart muscle becomes weak. And if you don't take the right prescribed medications to reverse that, it can be pretty dramatic. By giving him the right medicines that he took in a compliant way, his heart recovered. Initially, his heart muscle was weak down into the 30% range. On good medical therapy, it came back to a normal range of 55%.
Dr. McCants diagnosed Pastor Williams with cardiomyopathy, a condition that causes damage to the heart muscle. But the diagnosis came with a bright side. Pastor Williams was able to get treatment, and this unique treatment would stop the damage and even rebuild some of the heart muscle.
So hypertension is challenging, right? Because the majority of people don't have symptoms. And so when we're saying early detection, how can you detect something if you don't have symptoms? If you have a family history, or if you're African American and you're over the age of 30, then you should be checking your blood pressure at least a couple times a year, seeing what those numbers are, because you're in extremely high risk of developing high blood pressure.
Today, Pastor Williams takes medicine, exercises, and tries to turn his stress level down. He hopes that by sharing his story, he can save someone else.
Hey guys, we're here at Norton Community Medical Associates Preston to talk to Dr. Stephen Patton about navigating your healthcare journey.
So let's knock on the door and see if we can catch Dr. Patton. Hi, Dr. Patton.
Hey, how we doing?
I'm good. Thank you for making time for Abra and I to come and chat with you for a bit today. We're not going to keep you long. I know you're super busy and have a number of patients you want to see, but we just had a few questions with flu season and so many other things right now. We just wanted to ask you some really important questions about healthcare in general. And so I know my first question is, why is it important for us to have a primary care doctor?
Excellent question, and thank you for having me here today. So there's a lot of good reasons to have a primary care doctor. One, for having a primary care doctor is good for prevention, because we also talk about things like screenings and cancer screenings, vaccinations, and it's also good to get to know a provider, so in case something is off from your normal, that provider can recognize it, and it's good to feel comfortable, because I think trust is a big thing. So primary care doctor, you get to establish a relationship with that person.
So when I come to see my primary care doctor or my provider, what does that visit normally look like? And how often should I come in?
So when we're thinking about following up with your primary care doctor, there are different types of visits. The annual visit, annual wellness. Okay. So an annual wellness visit is pretty much starting off, there's nothing wrong with you, right? You're just going in there for a general checkup. Okay. And based off your age and anything else, chronic disease or anything, they're gonna look over you, and it's kind of like dragging a net through the water and seeing what we can catch. Okay. Then we're gonna get blood work on you, so that's when we do our screenings, like checking your cholesterol, screening for diabetes, and do we need to screen for colon cancer, prostate, breast cancer. So we set you up for your screening test, and then we also look at the different vaccinations. Are you up to date on your tetanus, your flu, your COVID, pneumonia, HPV? So any type of vaccinations that you might need for your annual that would be your like annual visit, and that's normally just once a year.
Okay.
Unless we need to follow up on those things that we screened for.
Okay.
Okay. And then the other one is a let's go with the acute visit, or sometimes they say problem focused visit.
Okay.
So a problem focused visit is kind of like your sick visit, right? We have an issue, it needs to be addressed, and we're looking for a solution. And we're trying to figure out what was the cause of that, right? And it's very important when we're doing a problem focus that it's very important just to talk about the symptoms that you're having and try not to lead with the diagnoses.
Okay.
So a lot of times we come in there, even myself, I'm guilty of it sometimes, like, hey doc, I think I got reflux, right?
Yeah.
But what that does is it really narrows you down. So it goes from here to here when you start thinking about different diagnoses, right? So it does more harm than good. And then we have a chronic disease
Okay.
visit. So a chronic disease is more so things that aren't going away in time. So a sick visit, I may have a cold that's only lasting for a couple weeks.
Yeah.
But when we start talking about diabetes and previous heart attacks or strokes or lupus or autoimmune things, those are things that are going to be a part of your lifestyle regularly. Okay. So when you do a chronic disease follow-up, it's more about, are the medications you on, are they doing what they're supposed to do? Also, it looks at how is the disease progressing. Are we making any dent in as far as your way of life? Are you able to function the way you want to? What are your goals? And are we helping you get to those goals? Because they're also looking at for like side effects too. So like, oh doc, I got this new pressure medicine, but now I'm causing swelling in my feet. So that's good to know. So do we need to change that or not? From there, they can decide, hey, maybe we follow you up 3 months, 6 months, or you're doing really good.
Okay.
And let's just see you again in a year for your annual, right? So that's for the chronic disease. And then we have the others category, which I call others, and this is real quick, like pre-op visits. So you, sometimes if you have a procedure scheduled, you have to get cleared for that procedure.
Okay.
So if you are going to get a kidney transplant or a procedure done, a heart valve replacement, we want to make sure, well, that's life-threatening, so
Your
are
body
you
can
able,
handle.
can you handle that? Versus a knee replacement, say, well, you know what, they just had surgery for their heart. You may not be able to tolerate that right now, so it's probably best to wait. And then we also look at other factors like your medication list. Is there anything we need to hold? Say, oh, you're gonna have this procedure, this medication thins your blood. Don't take that for the next 2 days or a week.
Yeah, that's
So-
really helpful. Yeah, thank you. I didn't realize that there were like four.
So many, yes. Yeah,
like
yeah.
4 different categories when trying to see a provider.
Yeah, absolutely. And I think that's the key point, is looking at that primary care as that foundation, right? So can you kind of talk about maybe what you would do for patients that need to be like a referral out to a specialist?
As a primary care doctor, we try to get as much as we can. But also at that point, we're gonna be referring on. So if I'm hearing a heart murmur and I know something going on with your heart, and I've tried to get your blood pressure under control and everything, but we need a further workup, like, oh, you may need surgery for this, I'm gonna send them off to the specialist. Or if I can't get your blood pressure under control, then I say, okay, you know what, I've tried everything we can do, maybe there's another cause, so let's send it off to the specialist, right? They see us as the first people on the line, so we can do a general screening, right?
Okay.
So for example, a lot of times if you're having reflux, the primary care doctor wouldn't send you straight over to
Okay.
the gastroenterologist,
Got
right? We'll say, oh, what's your diet modification? Here, try this medication, see if we can get, and if it's still causing problems, okay, well then you may need a scope,
Yeah.
right? We don't perform scopes here.
Right.
Right.
I'll let the specialist handle it.
So one thing I do want to say is that, so I think it's kind of like we're on this journey, right? I look at the first step is like primary care, and then understanding the referrals and the specialists. But then we think about some of those urgent situations that happen, right? And so sometimes, you know, we know most primary care offices have kind of set time and dates, but you know, what happens after those business hours? You know, so we think of like an emergency room or like an immediate care center. Can you kind of tell a little bit like the differentiation just between those two, and when it's the most appropriate time to use those type of facilities?
So the immediate care center is more so things that need to be urgently addressed, but they aren't life-threatening either, right? But you can't wait 2 to 3 weeks until it be seen, right?
That makes
So ER is, if your life is in danger, go to the ER. That's keep it real simple, right?
Okay.
If we're concerned about, if something is on there that's concerned about, oh, my life might be at risk if they don't find this out in the next 24 hours or so,
Okay.
this is all ER.
In the name, emergency.
Emergency.
Emergency,
yes,
right?
Yes,
Right.
yes.
But other than that, the immediate care, there's a lot of good resources there, and can do a lot of testing, and they also send notes to your primary care doctor from both angles, right? So I think those are some of the main differences between your primary care doctor, immediate care, and emergency.
You talked a lot about the notes that your immediate care doctor would have or the specialist with your primary care. Do patients have access to that information as well?
So majority of the times you can get access to your notes and your data. Okay. Now I'll also like to advise people to get signed up on their MyChart.
MyChart.
So when you go on to MyChart, you can look over previous labs, you can look over some previous notes and imaging. You can definitely look over your medications and your history, you can update that. And I think that's a really cool resource to have. Even with labs, as they come in, you can see it on MyChart versus having to wait to get the results from a provider, right?
Oh, that's so much great information, right? So I've learned actually some new things.
I did too.
As we talk about navigating, through your healthcare and just
We got a
healthcare
lot of
journey.
little healthy bites today.
A lot of healthy. Yes, I love that, healthy bites.
We're trying to be healthy.
Yes.
We talked about last episode eating healthy and what that looks like. And now all of this great information from Dr. Patton and Heather. Thank you, Dr. Patton, for making time for us. We really appreciate it.
No, thank you. I appreciate the opportunity.
Yeah, thank you.